All right, let's get started. Today, we're going on an investigation, and our target is one of the most common chronic diseases in the entire world. It's a condition that affects billions, but it's often completely invisible until it's way too late. We're talking about hypertension, and we're about to uncover how this silent condition really works, and most importantly, what you can actually do about it.
So here's the central mystery, right? How can something that makes you feel perfectly normal be one of the biggest drivers of heart attacks, strokes, and kidney failure? It's a paradox, and that's exactly what we're going to unravel today.
So, what are we really talking about when we say hypertension? Well, the official medical definition is a persistent elevation in blood pressure. That means the top number, your systolic pressure, is consistently 130 or higher, or the bottom number, the diastolic, is 80 or higher. And that word persistent is absolutely key. This isn't about one high reading because you had a stressful day or ran up the stairs.
Now, these numbers are broken down into different stages, which are basically risk levels. Anything under 120/80, that's considered normal. Great. Then you get into this elevated category, which is kind of like a warning light on your dashboard. Stage 1 hypertension officially starts at 130/80, and then Stage 2, which is more serious, kicks in at 140/90. These are the crucial clues doctors use to figure out what's going on.
Okay, so this brings us right to the first part of our investigation. Why on earth is this condition so dangerously quiet? And here's the most important point. While some people might get occasional headaches or feel dizzy, the vast majority of patients are completely asymptomatic. They feel totally fine, and that's what's so scary. It allows all this damage to happen under the radar for years, sometimes decades, which is exactly how it earned that chilling nickname, the silent killer. All right, if it's so common, what's actually causing it? Let's pull back the curtain and unmask the culprits behind this whole thing. You might find this shocking, but for a staggering 90 to 95% of people with hypertension, there is no single identifiable cause. This is what we call primary or essential hypertension. It's not one thing, it's a really complex mix of factors. So for that huge 95% chunk, it's a combination of things. You've got stuff you can't control, like your age and your genetics, but then there's a whole bunch of things you can control. Your diet, how much you exercise, and habits like smoking or drinking too much. It's not just one bad guy, it's like a whole gang of risk factors all working together. Now, for that smaller slice of the pie, that 5 to 10% with secondary hypertension, there is a specific underlying cause. And doctors have this handy mnemonic, CHAPS, to remember the main suspects. We're talking about things like a heart defect, hormonal problems, sleep apnea, kidney disease, or a narrowed artery to the kidney. And the great thing here is if you find and treat that specific cause, you can often cure the hypertension completely. So we know the suspects, but how do they actually commit the crime? Let's go inside the body, to the crime scene itself, and see the mechanics of how this pressure actually builds up in our arteries. You know, when you boil it all down, it really comes down to two fundamental problems. It's a plumbing issue, really. Either your heart is pumping out too much blood, that's increased cardiac output, or your blood vessels have gotten too narrow and stiff, making it way harder for blood to flow. That's increased peripheral resistance. And a lot of the time, it's a little bit of both. One of the body's main regulators is this incredible system called the RAAS cascade. Think of it like a thermostat for your blood pressure. When it works right, it's great. It raises your pressure when you need it. But in hypertension, this system can get stuck in the on position. It kicks off this chain reaction that squeezes blood vessels and makes the body hang on to salt and water. That's a perfect storm for driving blood pressure up and keeping it sky high. In fact, so many of our best blood pressure meds are designed to interrupt this exact cascade. So what happens when this pressure stays high for months or years or even decades? Well, now we're going to look at the collateral damage, because the entire body is essentially put under siege. This is where the silence becomes truly deadly. That constant hammering pressure damages critical organs over time. And there's a really powerful mnemonic to remember the main targets. Heart. H is for your heart, leading to heart failure or heart attacks. E is for your eyes, causing vision loss. A is for the arteries in your brain, leading to stroke. R is for renal, meaning your kidneys. And T is for a torn aorta, which is a life-threatening emergency. You know, the eyes give us this amazing window into what's happening inside the body. An eye doctor can literally look in and see the damage that hypertension is causing to your arteries.
And it progresses in these really clear stages, from just some narrowing of the vessels all the way to bleeding and swelling of the optic nerve. It's a stark, visible sign of the silent damage happening everywhere.
Now, there are times when this situation is no longer silent. There's a point where it starts screaming for attention. A blood pressure reading of 180 over 120 or higher is considered a hypertensive crisis. This is a true, no-joke medical emergency that needs immediate attention.
But even within that crisis, there's a critical difference. Is it a hypertensive emergency, meaning there's active, ongoing damage happening to one of those target organs right now? Or is it a hypertensive urgency, where the numbers are terrifyingly high, but for the moment, the organs are holding up? How it's treated depends entirely on that distinction.
Okay, enough of the bad news. It's time to shift gears because this is absolutely a solvable case. Let's look at how patients and doctors can work together to take back control. The strategy is basically a powerful two-pronged attack. It always starts with lifestyle changes. That is the absolute foundation of getting this under control. But when that's not enough to get to a safe number, that's when medication becomes the essential second line of defense.
And please don't underestimate how effective these lifestyle changes are. Things like cutting back on salt, following what's called the DASH diet, getting some exercise every day, and managing stress can have a massive impact, sometimes as much as a pill. These are the tools you can use every single day to fight back.
Now, when medication is needed, it's definitely not a one-size-fits-all solution. Doctors are really careful about selecting the right drug based on your entire health profile. For example, if you also have diabetes, you'll likely get one type of medication. But if you're pregnant, you'd need a completely different one. It's all about tailoring the treatment to the person. So let's just sum it all up. What's the bottom line? Hypertension is incredibly common, it's usually silent, and it can cause really severe problems down the road. But, and this is the big but, it is manageable. Early diagnosis and just staying on top of it with your doctor, that is absolutely essential to preventing the worst from happening. And that leaves us with one final, and honestly, the most crucial question of all. It's the single most important takeaway from our entire investigation today. You can't feel high blood pressure, but you can easily and painlessly measure it. So the question is, do you know your numbers?